The broken healthcare system for musculoskeletal pain. That's what we're going to be talking about today. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, and I'm coming to you with a big topic today, a real big one. One that I hope that you'll help me and consider sharing with your friends and family members. So let's hop right in, right? Yes, we have all known that the healthcare system has issues here in America, and we've known it for years and years. And we're not talking about Obamacare and all of that stuff, though. What I'm talking about is the broken part of the healthcare system that is not as apparent to people outside of the profession or the healthcare industry, and maybe not that apparent inside of my profession, but it is glaringly obvious to the ones of us that are paying attention. And trust me, I pay attention. If you know anything about me, you know I pay attention. Now, the broken part here is in the form of low back pain and non-complicated neuromusculoskeletal pain. Now, stay with me. Don't you go anywhere, because there's a big, long word there. What does all of that mean? Non-complicated musculoskeletal or neuromusculoskeletal pain, it means no obvious dislocations, cancer, anything like that might be significant enough to be a surgical issue or something like that. It's non-complicated. I want to be upfront here. I think this is common knowledge that there are a certain amount of chiropractors that are very anti-medical. They don't like anything about the medical world. They dislike and distrust medical practitioners. They discourage the use of pharmacology or prescription use. They discourage vaccines and things of that nature. Now, to be specific here, I am not that kind of chiropractor. I believe very much that an integrated approach amongst medical and chiropractic professionals is the way to go about treating pain. And when we treat it in an integrated approach like that, it allows the patient to be the winner every time. So when I say that non-complicated neuromusculoskeletal pain is not typically in the direct wheelhouse of a primary family doctor practitioner, understand that when I say that, it's coming from experience, not some sort of real bias on my part. I'm not against the medical world. To prove my point, I'll demonstrate that the American College of Physicians, led by Qaseem et al. In the Annals of Internal Medicine, not chiropractic stuff, they updated their treatment recommendations for treating long-term and short-term low back pain. For their first-line treatment recommendations, what they recommend that doctors do, the very first thing when they have long-term and short-term low back pain come into their office, they included things that many chiropractors offer for acute and chronic low back pain. Things like spinal manipulative therapy, exercise rehabilitation. We do that all the time, every day. Low-level laser every day. Massage, acupuncture, and heat. And essentially the exact same recommendations then emerged soon thereafter from a series of low back recommendations in the Lancet medical journal. The Lancet is a very popular, very prestigious medical journal. And the series on low back pain was authored by a worldwide panel of low back pain experts. So it was a big deal. And they said the same thing as Qaseem et al. In the Annals of Internal Medicine for low back pain. Chiropractic, low-level laser, massage, heat, exercise rehab, those things that we do here in our office every single day. Even the Journal of the American Medical Association, which has historically attacked and pretty much hated chiropractic over the generations, they published a paper soon thereafter in support of spinal manipulative therapy. So, you know, the tide is a-turning, folks. And now that you know what nationwide physicians groups have been recommending for low back pain for about 3 to 4 years now you can ask yourself what a family physician or even a surgeon would do with you right now if you went in for treatment. What would they recommend? Let's say that you wake up with terrible low back pain in the morning. God forbid, I don't wish that on you. But let's say that happens. You go to the doctor. What are they going to do with you right now, today? Well, I'll tell you what I think that they would do. And what I think they would recommend, you would probably get some combination of the following: a prescription strength ibuprofen, a prescription maybe for muscle relaxers. You might get a prescription for gabapentin if the pain runs into a limb. You might get a steroid shot in some cases, it just depends. Or you might get a shoulder shrug and you get punted like a football to a physical therapist. In and out, bing, bang, boom, next patient, please. That's kind of the way it goes with non-complicated neuromusculoskeletal pain. That doesn't make them bad. I'm not trying to say that. Please don't misunderstand me. I have the utmost respect for the medical community and I support them. But I support the following of current guidelines as well. And it's okay to hold their feet to the fire on it. Recall, first line recommendations by the largest group of physicians in America says 6 things that should be done first are done by most chiropractors, including this one sitting here talking to you. Yet, we don't see that in the most common recommendations coming from the medical world right now. Still, 3 to 4 years later, that's broken and it needs to be fixed. And that's only part of the problem though, y'all. Cost is a big part of the problem. The White House report in 2017 said that there are barriers set up by Medicare and by insurance companies that prevent patients from seeking care with alternative caregivers, people like chiropractors, and that these barriers should be done away with given the more current advice, information, evidence, and guidelines. And so it's coming from the very, very top now. You don't have to listen to chiropractors tooting their own horns. It's their traditional detractors and haters that are now tooting chiropractic's horns. Just for an exclamation point on the discussion here, let's throw in the fact that over 72,000 Americans died last year of opioid-related overdoses. 72,000, folks. Many of those became addicted to opioids through prescriptions for back pain. And those were prescriptions that just got out of hand, unfortunately. 72,000 Americans in 1 year, and I believe the total number of opioid-related deaths over the last 5 to 6 years is somewhere around the 450,000 deaths mark. That is insane. That's almost as many people that died during the Civil War when we were killing each other. And about 50,000 more Americans than died in World War II. I mean, it's just, it's numbers that will boggle your mind. So we should be worried about COVID, absolutely, as we all are. But this opioid-related deaths, it's still on the map, folks. It's still here, and it's not going away. And chiropractors have a big part that we could play in it. So let's give the VA system some credit, okay? They have taken notice of these research papers and these updated guidelines. And we chiropractors now, we do see a trickle of patients from the VA to get their veterans off of opioids. Thank God and bless them. And it's working. It's absolutely working. I can't tell you enough how effective it has been. Our veterans tell us all the time how much better they feel, how much better they're sleeping, and a couple have even said that they were thinking about suicide before we were able to finally give them some relief. Still, a systematic review came out just this month, which kind of spurred this whole video. And it came out showing that opioid use is being reported by 26.8% of people with chronic non-cancer pain. And you guessed it, still no sudden wave or influx of patients are coming to us from the medical field yet. But I say yet because I know that they're good people and they'll eventually come around. But not only that, but this on the insurance company side of things. A recent paper was just published last month by Whedon et al. Demonstrating an ongoing injustice in a broken system. This study was done in New Hampshire from 2011 through 2017, so 6 years there. And through that time, the odds of reimbursement for both acupuncture and chiro remained lower throughout that entire period when you compared it to a family practitioner. Now in 2017, as compared with the family doctor primary care, the likelihood of reimbursement was 72% lower for chiropractors. Seriously? Seriously. No offense here, folks. Just the truth. These are facts. But evidence-based chiropractors, certainly fellowship-trained evidence-based chiropractors, can run absolute circles around the typical family physician when it comes to non-complicated neuromusculoskeletal pain. Again, no disrespect meant here, but it's simply the truth. Those guys and girls have bigger fish to fry, like heart disease, diabetes, obesity, high blood pressure, cancer, and things like that, right? Simple musculoskeletal pain, it's just not in their wheelhouse. They weren't taught that much about it in medical school. Trust me, I know. But it is what we study. It is what we specialize in, and it's what we deal with every single day of our career. I'm 22 plus, almost 23 years in now, folks. Every day, pain. That's what I deal with. Honestly, which would you rather go to when you put it bluntly in those terms? A nationwide poll was conducted by the Palmer-Gallup group. It showed us that medical doctors and chiropractors are the top choices for neck pain and back pain in America. Medical doctors and chiropractors. So that's some good news on the chiropractic front. 53% said medical doctor was the top choice, while 28% said chiropractors. Interestingly, though, only 6% suggested physical therapy would be the top choice. But that's still the medical world's go-to referral right now, is the physical therapist, not the chiropractor. I don't know. I can't explain it. Also, interestingly, once people go to see a chiropractor, they're now just as likely to choose chiropractic first from there on for the rest of their lives. They're just as likely to choose chiropractic as they are likely to see an MD or a DO for their a medical doctor for their future pain. To the point where 3 out of 4 chiropractic users, 3 out of 4 chiropractic patients prefer to treat with a chiropractor first for significant neck and back pain. They prefer them over their medical provider. It seems the hump to getting over the hill there is just getting someone to try a chiropractor, a good chiropractor, of course. I mean, you don't want a bad chiropractor to be somebody's first experience, because then it's done from there. But the hump seems to be just getting somebody to go to a good chiropractor one time, and then it's usually going to change things for them. This poll also showed us that one of the main reasons that people won't go to a chiropractor in the first place is because they don't trust chiropractors. Another reason that they don't go is that they don't think it's safe to go to a chiropractor. Now, all I can say there is these concerns can be put to rest by simply saying, you trust your family physician, and your family physician's main group, the American College of Physicians, now says essentially, go to your chiropractor for back pain. There's your trust issue, and there's your safety concern, all wrapped up in one single recommendation by a group that is the ultimate cultural authority in the medical field. So to wrap it all up, in the 2018 Palmer-Gallup report, it showed 93% of patients felt that chiropractors listened more. That's compared to 88% for the PTs, physical therapists, and 72% for MDs and DOs. Chiropractors win. It showed that 52% treated with chiropractors based on effectiveness, which compared to 42% for PTs and only 23% for MDs and DOs. And 91% felt that their chiropractor showed compassion, compared to 86% for PTs and only 66% for MDs and DOs. With huge medical groups, the most respected medical journals, and the White House now all recommending more widespread use of alternative care like chiropractic, and the dismantling of the insurance industry barriers against alternative care, it's now time to fix this very broken aspect of our healthcare system. It no longer makes sense. when the research is so very clear of the benefits of an evidence-based chiropractic practitioner? Why would you not want to be treated by one? Safely, conservatively, cost-effectively, and without drugs or surgery. Doesn't that just make common sense? When compared to treatment with a physical therapist and or a medical primary care doctor, chiropractors almost every time come out on top of the heap in research papers. We come out on top of the heap with our patients getting better results than the rest of the groups, being happier with their practitioners, and they have spent less money with their chiropractor to get out of pain than they would at a physical therapist or with their family doctor. And sometimes, folks, 2 + 2 = 4. You know what I'm saying? For non-complicated back and neck pain, you see an evidence-based, patient-centered chiropractor first every single time. Again, I hope you'll help me spread this message by sharing this video with your network of family and friends. If people don't know, then they just don't know. Sometimes we have to show them. And that's what this is all about. So I appreciate your help. If you're watching on YouTube, can I talk you into hitting that subscribe button so that you don't miss any other valuable videos? If you're watching on Facebook, give us a like and a share, please. That is so simple to do. If you're in the Amarillo area or you'll be traveling this way and you want to be evaluated and treated by us here at Creekstone, visit our website at creekstonecare.com, or better yet, just call us at 806-355-3000 and let's get you on our schedule so we can help you get to feeling better. Again, I'm Dr. Jeff Williams. Stay safe and we'll see you next week.